Been a crazy couple months here across the country as we have more and more regulations being published, taking effect with various different dates. And this can be a little bit dizzying no matter what kind of business you are. But if you are in the state of Virginia, it has been very confusing of which OSHA mandate or standard is in effect. And so in Virginia, as you guys might remember, we have the Virginia standard that was put in place. Remember, the first state in the country that actually put in an emergency temporary standard. This was back in July of 2020. It became permanent in January. We have an update in October, and that fully becomes effective with all the training requirements as of November 7th, which is fast approaching. Now, we also have the executive order that Biden put in place a couple months ago. That has taken effect, and that just came out yesterday. Please see my video on that tries to explain some of the information. We actually have a downloadable FAQ to help. Now, that only applies to employers who are 100 or more. Now, if you aren't 100 or more, the Virginia standard is going to take its place. And if you are a medical facility, this is what we're going to talk about today. And as you might remember, there was an OSHA emergency temporary standard that was just put in place in the last couple of months just for healthcare providers. And so I'm not going to go into that here much at all. I might reference it a little bit, but what we're really going to talk about today is the CMS. So if you are a medical provider and you collect Medicaid or Medicare revenue, then this applies to you. We're going to dig into a little bit more of what providers this really affects, and we're going to dig right into this. And so the healthcare ETS was about almost 300 pages long. It's very detailed. There's a lot of information in there. If you are a medical provider, there are some exemptions, especially if you're a non-ambulatory facility here in Lynchburg. So if you're a physician's office, if you're a radiology office, there are some distinct exemptions, and there's some things that you must do in order to be exempt from that very complicated standard. And there are some things in there that have some real teeth. So you really want to make sure that either you have to follow it and make sure you do, or if you're exempt, rest assured and breathe a little easier. So be happy to make sure that you understand if it applies. If it doesn't, just remember, if it doesn't apply, then you've got the federal 100 plus rule or the Virginia that applies if that 100 plus rule doesn't. So there's 3 or 4 different things here, 3 or 4 different laws that are in place, and we need to kind of figure out which one applies to you. So no matter what you think, something applies. It's just a matter of which one and how much teeth that particular law has. So what I'm going to dig into just today is the CMS. Again, if you're a Medicaid, Medicare provider, then this may apply to you. And so I'm going to dig into this a little bit. I got my screen shared right here. And so the key thing is there's going to be a couple dates in which this is going to apply. And so phase 1 is going to take effect 30 days after publication. So what does that mean? December 6th. And really what that means is your employees really should have that first jab. If they do not have any level of vaccination, whether the first jab or second, by December 6th, they have to have at least the first jab done. Now, if it's the Johnson & Johnson, it's one and done. So by phase 2, though, we have 60 days for that to be implemented. And then really that is January 4th. And really what that means is both jabs have to be completed. And so really, who does this apply to? There are a lot of different types of medical facilities out there. The CMS specifically details all the various facilities that this applies to. I've got them on my screen: ambulatory surgical center, hospice, psychiatric treatment facilities. You've got long-term care or elderly care, critical access hospitals, clinics, rehabilitation agencies, and public health agencies, that provide physical therapy and language pathology services. So, there's a lot here. And if one of these applies to you, you're going to have to follow this vaccination mandate. And this is exactly what this is. This is a vaccination mandate. Unlike what Biden put in place through his executive order and what OSHA has finally promulgated through its standard, that is technically not a vaccination mandate. So we kind of thought it was, but they, as they put it, they've got some flexibility for employers to either fully mandate a vaccination, or if they don't want to mandate a vaccination, they can implement weekly screenings of their employees. And the good part about that is the employees have to pay for their screenings, and it has to be done once every 7 days. That is not a mandate. This is a mandate. So this is a little bit more teeth, a little bit more enforcement when it comes to vaccinations that we really have not seen before. So if you are getting money from Medicare and Medicaid, and if you want to continue getting money from Medicare and Medicaid, this is forcing you as an employer, as a medical facility, as defined on this screen, you're going to have to enforce your employees to get this vaccinations. Now, this is a not too long of a document, unlike the healthcare ETS, which was about 280 some pages, 270 some pages. This is only 70 some pages. I think it's 78 if I remember correctly. I'm just going to briefly go over some takeaways. There's a lot of nuggets in there, and so I'm not going to hit on exactly everything in this video, but you'll get a clear idea of really what is expected of you. So this does affect Medicare and Medicaid. Already said that. This is complementing. This does not replace the healthcare ETS, and they're very specific in this document to relay that information, is that you still have to follow all of those healthcare ETS guidelines unless you are an exempt provider. Now, this is all staff must be fully vaccinated unless they are exempt, and we'll get into that just a little bit. Now, what do they mean by fully vaccinated? What that means is they're going to follow the CDC guidelines here. CDC has defined what fully vaccinated means, and really what that means is as being 2 weeks or more since completion of a primary vaccination series. So if you've got the Johnson & Johnson, it's one and done, you're good. If you've got the Moderna or the Pfizer, 2 jabs, and really what they want is after the second jabs, you really need 2 weeks after that second jab to be considered fully vaccinated. Now, if you are coming up to that January 4th deadline, you've already got the second jab, but it hasn't been 2 weeks. CMS is saying they're going to give you some leeway here in that they'll consider this in compliance. So not to worry there if you're kind of up against that deadline. Now, what they also are saying is fully vaccinated does not mean that you have to get a booster shot. There are a lot of people who are, a lot of people who aren't. They are not considering booster shots as a part of this fully vaccinated definition. Now, what they do are going to require some infection and prevention and control guidelines. Now, they're saying is there are other things that employers are going to have to do, and really if you're just following the CDC guidelines when it comes to infection, prevention, and control, you're going to be in good shape. There's a lot of information out. If you need some of those guidelines, because you don't have it already, if you're in the state of Virginia, you pretty much know this stuff. This has already been out, again, since we were the first in the country to even implement an ETS or emergency temporary standard. It went permanent in January of this year. So if you're in Virginia, you're probably 99.9% there. So I'm kind of speaking to the choir. Documentation is a big takeaway. They are going to require you, they being CMS, is going to require you to have documentation of staff vaccinations. And I'm going to go through that a little bit more here in just a minute. Now, key takeaway continued. They're going to require implementation of a process by which your staff can ask for an exemption. So they are aware that there are certain exemptions that apply, and they're really just looking at applicable law here. And the applicable law, as they define it in the CMS, is ADA, looking at Section 504 of the Rehabilitation Act. We're looking at the ACA, or what's otherwise called Obamacare. And really the most important one is going to be Title VII of the Civil Rights Act. It talks about discrimination for pregnancy in there as well, but there is a whole other act called the Pregnancy Discrimination Act that technically still applies here as well. And really what this means is you should have an interactive process when it comes to any of these Title VII or ADA guidelines. This is not, a simple little process that you just check the mark. This is where you can access Ronnie Smith here at our agency. She's our executive or senior employment advisor, and she can walk you through that steps if you really don't understand what it means to have an interactive process around Title VII or ADA in particular. So what the CMS is also saying is that if applicable law applies here, you need to document. You must document exemptions in accordance with federal law, but you also have to have, and they point to your facility's policies and procedures. And so if you don't have policies and procedures, if you don't have job descriptions as well, and that's kind of dealing with ADA here of what is an essential job function, this could be a problem for you guys. If you don't have established policies and procedures, that could actually come back and bite you in the rear end. So just make sure that you guys have got all of this stuff kind of nicely, tightly, and tightly organized with a bow on top. With your facilities policies and procedures. Also, they're pretty adamant of making sure that they are in control here, that this preempts any state or local laws providing exemptions, unless those exemptions are really following federal law. So if you're in an area where there's a local law or a state law that is trying to prevent vaccinations, they're pretty adamant in saying in this new regulation that this law preempts all of that and not going to apply. And so what they're also saying here is because of these exemptions for employees, you're talking about maybe religious exemptions, maybe even some medical exemptions. And if other employees know about this, there can't be any type of retaliation. It can't be done by employees. It can't be done by management. And so must take that into consideration as well. Now, looking at the staff subject to COVID-19 vaccination requirements, really what they're saying here is all employees. And it doesn't really matter if this is clinical or if they have patient contact or not. They're really wanting every single employee, even the back office administration, even though they don't have any patient contact, they want them to get vaccinated. So really, it's kind of quite a list here: facility employees, licensed practitioners, students, trainees, volunteers. Now, one thing to remember on licensed practitioners, what it states in the CMS regulations is if you are not on that list of medical facilities that have to adhere to this, but you have doctors or practitioners that have hospital rights, then those physicians have to be vaccinated. Now, I've already talked to a lot of medical firms here today. Centra has already mandated vaccinations. Most of the doctors who have privileges at the hospital are already vaccinated. So this is really not going to be a major concern for people here in Lynchburg, just because of what Centra has been doing to enforce the vaccination mandate with their staff and any practitioners that have rights there. So just something to think about there is, even if you're out of state and you are not on this list, but your doctor has hospital privileges, then those doctors will need to get vaccinated according to CMS. This is going to even include telework employees. Now, what they're saying here is if telework employees come into the office at all, then they have to be vaccinated. So if they're coming in for any type of contact, picking up documents, staff meetings, even if it might be only once a month, they're very clear in the CMS regulation that these telework employees still have to be vaccinated. So something to ensure on your side if that applies to you. Examples of acceptable forms of vaccination proof. The easiest one is CDC vaccination card. Now, you can't have a picture of it. If that's all you have, that's fine. Documentation from a healthcare provider is obviously going to be acceptable. State immunization information system records. And you can also use your own tracking tools. You can use whatever kind of HRIS system you have or another type of tracking system. You can use the CDC tracking tool. You can see the website there that you can go to on the cdc.gov website. But again, you can use whatever tracking tool. But the key thing here is CMS is very adamant. You have to track. You have to keep all of that, all those records, and make sure that you're really in compliance there. That's kind of the quick highlight of what the CMS is saying. I apologize for getting this so late on a Friday, but with all of the other regulations coming out, and we've got, unfortunately, the reconciliation bill that is about 2,400 pages that we've read here in the office. And just to warn you, if you haven't listened to some of the other videos that I have out, that reconciliation bill, which I think it's supposed to be on the docket today for a vote. I haven't looked at the news to see if that went through or not, but in that bill, they specifically have hundreds of millions of dollars for various government entities like OSHA to help with enforcement. And so the government is pretty adamant about going after the big kind of stick here, or major incentive for CMS is that, hey, you'll lose your Medicare and Medicaid revenue stream. If you're on the OSHA side, fines are now $13,600. We're already seeing here locally that has been that stick has been applied, that we are seeing fines, unfortunately. Now, if you need help, really, this is not going to be a huge deal. We've got some simple solutions we can help you implement. We don't want you to freak out. We don't want you to stress. We've got highly knowledgeable individuals here on our staff on the safety side and on the HR side. Actually, we even have a OSHA, Virginia OSHA enforcement officer who has been in the OSHA enforcement for 30 years, is now on our team. And we have a lot of staff here to help you, again, whether it's HR or safety. So feel free to reach out. You can reach us at info@midstatesafety.com or info@midstatehr.com. You can always give us a call as well, 434-528-1001. My name is John Basten. I'm the President and Chief Growth Officer here at the Midstate Group. And again, we're here for you if you need us. Thank you for your time on a Friday.